What tests will I need to do for my acute myeloid leukemia and how often?
So ideally, the testing that a patient would require for acute myeloid leukemia would be a bone marrow biopsy. So we take a little piece of the spongy part of the inner part of the bone in the hip, and that is where the bone marrow resides. We also, when we enter the bone marrow, we pull out what's called the aspirate, which is the blood in the center of that spongy tissue, to really help us understand what the cells look like. So, what these immature blasts look like, those characteristics are important to us. The number of those blasts are important to us. And then that's where we pull the genetic information. Sometimes we're able to get that information from the blood. Sometimes you miss some of the sort of low-level variants that might be expressed in those patients, but it's possible to do the full workup from the blood alone, just depending on the burden of illness. And then once we have a diagnosis, there are a lot of blood tests ahead. And because so much is required of patients in terms of blood draws, we do generally recommend that patients have a central catheter, so either a PICC line or a port, to help us easily draw those lab values and help us easily support them back with transfusions. So there are bone marrow biopsies often along the way. So the first one usually comes after the first bit of treatment, where we try to see if the leukemia is gone or not. And then future biopsies really depend on what your future treatment is after that. So typically there's the first treatment that gets the leukemia to go away, and then future treatments are to keep it away. So if it's a few more rounds of chemo, at the end of that chemotherapy, we get another bone marrow biopsy to ensure the leukemia is still gone. If after you get the leukemia to go away, if we know there's still a high chance that it might come back, sometimes patients will go on to a stem cell transplant. Once you have a stem cell transplant, there's several biopsies that follow that as well. And it's all to ensure that we're not missing any leukemia that might be trying to come back.
So when managing someone's AML, there are several tests that will be done, but most common and most often, it will be a bone marrow biopsy. Because the cancer lives in the marrow, we need to go back to that source to assess how well it's responding to treatment. So a patient will get a bone marrow biopsy, which will tell us how prevalent the disease is at diagnosis. And then we like to repeat a bone marrow biopsy after the first 2 or 3 rounds of chemotherapy to see how well they responded. We use CT scans on staging to see if there's any evidence of disease outside the marrow, but that is rare. So moving forward, once we've started treatment, performing just routine blood work like a CBC, looking at blood counts, performing a bone marrow biopsy once every cycle, or in a lot of cases once every few cycles, gives us an idea of how to monitor the prevalence of blast or leukemia cells in somebody's bone marrow. And then more and more frequently now, we're utilizing what we call MRD, or measurable residual disease, which is a way that we can track the mutated genes or mutated characteristics of acute myeloid leukemia at a very low molecular microscopic level. Because in theory, the lower you can eradicate a disease, if we can monitor that to a very low level, then we can also see at a very low level that it's starting to come back before it actually does, and that's what relapse is. So in some patients with certain mutations, we're actually able to do those tests, those MRD tests, either on blood or bone marrow, which that's been a big game changer in AML management.